Well, to follow up on that, with me now is Dr. Imran Omar, who works with the EAU Guidelines Office. Hello to you.
Hello.
So what is your response to the fact that sometimes patients really don't understand the treatment options?
I'm not surprised because, I have done some focus group in which we have involved patient and, sometimes patient, they don't know exactly what may happen. And, many of the patient in my experience from the focus group that I have done, sometimes they read information from the internet. So sometimes they also get wrong information from the internet and they may not have the opportunity to discuss with their healthcare professional all those things. So there are two things. One is having wrong information about something, and second is to clarify things. And it's very important that they should be given an opportunity to clarify their views.
Now, bearing that in mind, you still think patients should be very much involved in groups where there are systematic reviews of practice. Tell me about that.
Yeah, definitely they should be involved. It may not be feasible or financially possible because there are various hurdles in the process, but it's extremely important. Patients should be at the heart of systematic review. If you look at the guidelines of the GRADE working group, where we select outcomes which are critical for the summary of findings table, it clearly says that the outcome should be selected from patient's perspective, which are important from their views and decision making. Now, what happens in majority of the systematic review, urologists or other healthcare professional or research scientists, they are the one who make those decisions, and patients are ignored in that decision-making process. So it becomes extremely important, and we have done some focus group in which we have involved patients and we have explored their views before selecting or finalizing the outcome.
And what's the biggest challenge, do you think, in making sure that patients understand properly?
One thing is the communication, because the terminology. So for healthcare professional or urologists, things are easy to understand, but sometimes from layman's perspective, it's not easy. And when we talk about the European Association of Urology or international guideline, we have to think about other languages as well, because English is not my first language, and I know the challenges involved with English. It's so easy to understand, but I don't know many words in my local language. So if I'm saying a dissemination of a disease, there may not be equal term in other language. So that's the biggest hurdle, especially if you're talking about countries where English is not the first language and many people, they cannot speak English.
Well, Dr. Omar, thank you very much for your time.
My pleasure. Thank you.